Next up, we have House Bill 945, and we will ask Dr. Tim Frost to introduce himself for the record and begin with this presentation. This is meant to be just an introductory or educational hearing, so if you would proceed, Dr. Frost.
Thank you, Chairman and committee members. Appreciate the opportunity to testify today. For the record, my name is Tim Frost. I'm a licensed pharmacist and a Boise resident in District 16, here on behalf as a senior fellow of Cicero Action. House Bill 945 is the AI Medical Services Act. It addresses one of Idaho's most pressing challenges today, access to timely health care due to critical provider shortages. Idaho is already projected to be more than 1,700 physicians short by 2030. 39 of our 44 counties are already designated as health professional shortage areas. And artificial intelligence is already helping triage patients, monitor chronic conditions, interpret diagnosis. But many of these tools today, they operate as an informational or an advisory clinical AI capacity. Emerging, supervised, and fully autonomous clinical AI now needs a clear pathway, which current law simply does not provide. Because Idaho law defines diagnosing, treating, prescribing as a licensed practice of medicine, and similar practice authority definitions exist across other healthcare professions, technologies capable of performing these clinical functions are currently prohibited or at a minimum have no clear regulatory pathway under existing statute. 10 years ago, the legislature battled with this as it relates to telehealth and virtual care. Rather than leaving each licensing board to interpret virtual care differently, the legislature created a clear statutory framework that allowed telehealth to grow safely across Idaho. This bill's goal is simply to take a similar approach for clinical AI. Oversight is centralized into a single board of autonomous medical practice to prevent fragmented rulemaking. Reciprocity pathways and defined 90-day decision timelines prevent regulatory delays from blocking progress. Any restrictive rules must be supported by clear evidence and approved by a 2/3 vote of the board. And the statute expressly prohibits restrictions greater than necessary to address any identified risk. The result, Idaho patients can receive care faster, chronic care monitoring and time-sensitive triage that patients maybe potentially have to wait weeks for can happen immediately. This expands access to Idaho while leading the nation in responsible AI healthcare innovation. At the same time, the bill does have very strong safety guardrails from a patient safety perspective. First, it does not expand or restrict the scope of practice of any existing healthcare provider. Second, AI systems must meet the Idaho community standard of care that applies to reasonably and prudent human clinician performing the same function. Third, supervised autonomous systems require a human clinician in the loop, and every licensed licensed AI provider must designate a licensed physician as the medical director for clinical oversight, safety protocols, and escalation pathways. Fourth, all new systems begin under a provisional license in a regulatory sandbox where safety and performance data are evaluated before full authorization. And fifth, patients must receive clear disclosure when AI is involved in their care, and they retain the right to request human review or seek care from a licensed clinician. The bill also establishes accountability measures, including adverse events reporting, algorithm auditing, liability coverage, and professional duty of loyalty, requiring the AI systems to act in the patient's best clinical interest, while making sure that nothing in the act authorizes conduct that's currently prohibited under criminal law in Idaho. The bill does establish an autonomous medical practice board within the Division of Occupational and Professional Licensing. This is an 11-member board that's intentionally designed to balance oversight and prevent regulatory capture. It includes a physician, a registered nurse or APRN, a pharmacist, a mental or behavioral health professional, a public member, a medical ethicist, and technical experts in artificial intelligence. The goal here is to ensure we have both clinical expertise and technological expertise when making decisions as it relates to clinical AI services. From a fiscal standpoint, the board is structured like any other healthcare professional licensing board under DOPL. It would be self-funded through licensing fees with no ongoing impact to the state general fund. Notably, and from conversations with JFAC, several of the healthcare boards under DOPL do have high cash balances. I do think one potential option for the legislature, if you were to go down this pathway, to be one-time funding of current dedicated funds under DOPL's existing dedicated resources. After that, it should be a self-funding through licensing of these clinical AI companies. At its core, the legislation sends a simple message. Idaho is open for responsible medical AI innovation while protecting patients and upholding the community standard of care. I think rather than leaving these technologies in a gray area and clear prohibitions under the practice of medicine and unlicensed practice, effectively prohibiting all clinical AI services on an autonomous level in Idaho, this bill creates a clear, transparent, accountable framework that lets hospitals, providers, and technology companies deploy clinical AI safely. Mr. Chairman, I appreciate the opportunity to present this bill today. Certainly committed to answer any questions, work with you in the interim, work with stakeholders in the interim. I think there's a pretty wide continuum of interested parties in this bill, and we'll work with them on it.
Thank you, Dr. Frost. Committee, any questions? Representative Crane, 13.
Yeah, thank you, Mr. Chairman. What's your pleasure? Are you wanting us to send this on to the floor? Are you wanting us to hold in committee? So some direction as to what maybe you're thinking you'd like to do.
Thank you, Representative. I think this is an excellent bill, but I think we'll probably hold off just to have a little bit more conversation with the stakeholders. So a hold in committee would be what appropriate.
I'd move to hold House Bill 945 in committees or subject to the call of the chair.
Yep. All right. Thank you, Representative. Representative Cheatham.
Thank you, Mr. Chairman and Doctor. Would this apply to all medical fields in the state of Idaho? Are there any exemptions under what you're proposing?
Dr. Frost.
Chairman Redmond and Representative Cheatham, this would apply to all licensees under Title 54 of Idaho Code. So yes, both the practice of medicine and the practice of other licensed healthcare providers in the state of Idaho.
Follow-up?
Follow-up. Thank you, Mr. Chairman. Doctor, would there be any human oversight of decisions rendered by AI, or could this system be hacked and things go very awry?
Dr. Frost.
Chairman Redmond and Representative Cheatham, thank you for the question. So this bill creates, I'll call it a licensure framework. I think in your meeting materials, it shows kind of a quick reference table of what's exempt from licensure and what ultimately is mandatory to licensure. The vast majority of clinical AI that is advisory or informational is exempt from licensure. In other words, this bill does not introduce new licensure over that, because we know that exists today in hospitals and provider offices in various different technology companies. Where it pivots to requirement of licensure is when AI or clinical AI is now making an autonomous decision as it relates to patient care. That would trigger then licensure. So any type of supervised autonomous scenarios that would prescribe a medication or interpret a laboratory test or ultimately dispense a drug, those would be situations that would require licensure. And that's no different than how we would similarly approach current healthcare licensees. There are some scenarios that the act of what they might work with a patient is exempt from licensure, and then there are what we would call there falls within the practice of medicine or the practice of pharmacy or the practice of nursing that then triggers licensure requirements. So as it relates to human in the loop, any entity that would be required for initial licensure under a supervised autonomous AI is required in that sandbox for that first 2-year period to have a human in the loop procedure. And so there must be both of the company a designated medical director, but also the ability for a human in the loop to come in at the different processes. We leave quite a bit of flexibility to the board to kind of create the framing of how restrictive they want to be initially to open the door. But I think it creates a long-term pathway, or at least consistent pathway, if we want clinical AI to exist in Idaho long-term, rather than a very narrow pilot project. This creates a regulatory framework for them to innovate, but still have maximum flexibility from a DOPL perspective if they want to place restrictions on that entity.
Vice Chairman Wheeler.
Thank you, Mr. Chairman. Dr. Frost, curious, I was trying to see if I could understand, on the board, you mentioned there would be tech experts in AI. I'm learning, there's things like conversational AI. There's things that are, you don't have to have a subscription for, and it's just, research AI. would there be any sort of expectation or limitation on who those AI tech experts could be, and who makes that determination of which AI tech experts sit on the board?
Dr. Frost.
Chairman Redmond and Vice Chairman Wheeler, thank you for the question. So on page 6, it would be 546003. It details the Board of Autonomous Medical Practice. All of these are governor-based appointments. So they serve at the pleasure of the governor. They're appointed at the governor. They are not Senate or House confirmed. The framing as it relates to the other 4 members at large details they could be in healthcare technology, artificial intelligence, system engineering, healthcare administration, patient safety, or regulatory affairs. So the governor would have that as the framework to select those 4 individuals.
Committee, any further questions? Seeing none, we do have a motion before us to hold.
Mr. Chairman, sorry.
Oh,
You no longer have a motion before you. The maker of the motion walked out the door.
Okay.
If you'd like, I'll make a new one. I would move to hold the bill in committee time certain, or no, have to call the chair.
thank you, Representative. We do have a motion to hold the bill in committee, subject to call of the chair. Any further discussion? Seeing none, all those in favor say aye. Aye. Any opposed? Motion does pass, and we will hold House Bill 945 in committee. Thank you, Dr. Frost.
Appreciate it.